afternoon, everybody. I am thankful to Dhar sir and the organizers of NMOA for inviting me to give this talk, Reduction of Collisis Fracture in OPD under Hematoma block. Hematoma block, the block has been successfully used to minimize the pain after prior to the otherwise painful closed reduction maneuvers for distal radius fractures. Why back, way back it was practiced by Watson Jones in reduction of fracture, but at that time he was not recommended it. Indications are closed fresh fractures, both intra and extraarticular fractures with dorsal combination less than one-third of the diameter of the distal radius without significant metaphyseal combinations. Contraindications are naturally compartment syndrome, neurovascular injury, allergic to lignocaine. Method: the dorsal side of the wrist is then prepared with all aseptic precautions and wrapped in a sterile manner. 5 to 7 ml of local anesthetics, Xylocat 2% I use, is used since it doesn't contain methyl polyben as a preservative. The part is thoroughly prepared nicely and I inject dorsally. Next. Five to I'm just uh, checking if it is working or not. Since the pain is reduced, now the method of reduction, I usually give traction in supination. The whole idea is to to exaggerate the deformity, which I picked up from John Chanley's book, Common Conservative Treatment of Some Common Fractures. Here I am giving it in supination. Yeah, I exaggerate the deformity by the is it is disimpacted properly and the rotation and radial deviation is reduced to some extent. The deformity is now exaggerated totally. Then I will pronate the forearm and the traction is on and I am reducing it. I will, if I am happy, I will give it tracks. I will give a cast. Above elbow cast is a rule of thumb. AOS people always give above elbow cast. There are some cases. In nutshell, explain the patient clearly that if this method fails, then surgery is the next option. If patient agrees for close reduction, step to follow is patient is in supine position under all safety precautions, hematoma block given, wait for 5 to 7 minutes till pain subsides, reduction maneuver done, below elbow cast, gypsum are done, check X-ray taken. If satisfied, as a rule of thumb, above elbow cast applied for 6 weeks, patient home and follow up after 10 days for check X-ray. If happy, then continue the cast. Some cases. Uh, this is pre-reduction, immediate post-reduction, and after 1 year follow-up. This is the clinical result. Then another case, pre-reduction, then immediate post-reduction, then after 1 year follow-up. This is the reduction. Then another case, I have also extended to some cases of volar batten also. This is the result. This method, exaggerating the deformity by fast traction, counter traction in application, I picked up from John Chandler's book, The Close Treatment of Common Fractures. This is his book, he was giving the traction like this. Conclusion, hematoma block is a safe method for obtaining adequate analgesia for close reduction of distal radius fractures. It is a cost-effective method and a day care method. Thank you, sir.